What features make medical facilities accessible for people with disabilities? Have you ever wondered what makes a medical facility truly accessible for individuals with disabilities? It's not just about having a ramp or a designated parking spot. Accessibility is a combination of thoughtful design and practical features that ensure everyone can receive care comfortably and independently. Let's break down the essential elements that create an inclusive healthcare environment. First, accessible parking and entryways are vital. Facilities should have designated parking spaces located close to the entrance. These spaces should be wide enough to accommodate individuals with mobility devices. Entryways must be barrier-free, meaning ramps or lifts should replace any steps. Doors should have lever handles instead of knobs, making them easier to open for those with limited hand strength. Additionally, doorways need to meet minimum width standards to allow wheelchairs and mobility aids to pass through without difficulty. Next, the interior spaces of medical facilities must be designed with accessibility in mind. Clear pathways are essential throughout waiting rooms, hallways, and exam rooms. These pathways should be free of obstacles and provide enough space for wheelchair turning. Bathrooms should also be accessible, featuring grab bars, accessible sinks, and enough room for maneuvering. It's important to avoid any protruding objects that could cause injury or obstruction along travel routes. Accessible medical equipment plays a crucial role as well. Examination tables should be adjustable in height, allowing for easy transfers from wheelchairs. Diagnostic machines, such as mammography units, should accommodate seated patients. Weight scales must be designed to measure individuals while seated in their wheelchairs. Patient lifts and mobility aids can assist in transfers and movement within the facility, ensuring that everyone can receive the care they need. Sensory and communication accommodations are also key features. Facilities should provide quiet, low-stimulation rooms for patients with sensory sensitivities. Clear signage with large print and braille is essential for individuals with visual impairments. Additionally, having communication aids, such as sign language interpreters or assistive listening devices, can make a significant difference in the patient experience. Staff training and policies are equally important. Healthcare staff should receive training to understand the needs of individuals with disabilities and provide respectful, personalized care. Policies should allow for reasonable modifications to standard procedures to accommodate specific needs unless it fundamentally alters the service. Collaboration with caregivers and the use of personal assistants when necessary can further enhance the care experience. Lastly, compliance with legal standards is non-negotiable. Medical facilities must adhere to the 2010 Americans with Disabilities Act standards for accessible design. This law sets minimum requirements for accessible features in new constructions and alterations. Existing facilities should remove architectural barriers when possible or provide alternative accessible services if barrier removal is not feasible. In practical terms, this means that a person using a wheelchair should be able to enter the facility without encountering steps, navigate to the exam room without obstacles, use the restroom independently, and receive an examination on a table that can be adjusted to their height. A person with sensory processing issues should have access to quieter spaces, while someone with hearing impairment should be able to communicate effectively with healthcare providers. Overall, accessible medical facilities are designed to ensure that individuals with disabilities receive equitable health care. By addressing physical, sensory, and procedural barriers, these facilities create environments where all patients can access care comfortably and effectively.